start with our new remedy, ANACARDIUM ORIENTALIS, in the 29th episodes of Phatak Materia Medica live series. So, let us start and decode the anacardium, a big remedy, a remedy which is more used in psychological cases or more have a mental symptoms. So, let us understand anacardium in a simple way and how Dr. Phatak describes it. So, according to Dr. Phatak, it is a neurasthenic remedy. Patients of anacardium are neurasthenic. So, what does means in the OPD language or day-to-day our practical language? Neurasthenic patients have a nervous exhaustion, mental weakness, physical weakness, loss of confidence, loss of power, mental and muscular. This remedy affects mind, nerve, muscle and joints. So, this is not just a mental remedy, this is a mind, nerve and muscle remedy. So, Phatak repeatedly used the phrase in this remedy that lack of power, mental lack of power, physical lack of power, violational lack of power. So, whenever you see a weak willpower, weak nerves, relief from eating, anacardium must be come to your mind. So, essence of the anacardium personality is that central theme of the anacardium is I know what is right, but I can't do it. I know what is right. He knows what is right or wrong, but he can't do it. He can't do it. So, this is the patient who is at odds with himself, fighting inside, divided within. So, Dr. Phatak describes that illusion of duality has a two wheels and two wheels, two person. So, in day-to-day practice, we may say that a student who knows the answer but freezes during examination, a professional who knows the task but keep postponing, a person who wants to work but cannot start, a mental conflict, conscience on one side, impulses on other side. So, anacardium lives in a permanent inner conflict. So, how does this patient thinks? So, patient may say that doctor, I feel confused, doctor, I feel hesitated a lot, my confidence is gone, doctor, my money has betrayed, my memory has betrayed me. So, for Dr. Phatak explained in way that bad memory, sudden forgetting the names, forgetting the people surrounding, feels like everything is unreal, as if it is a dream. So, this is not Alzheimer's memory loss, this is a functional, nervous, confidence related memory failure. Confidence related memory failure is anacardium. So, Dr. Phatak especially mentions that fear of examination in student. This is a golden keynote, not just examination fear, but the fear with memory failure, lack of confidence and mental exhaustion. See the patient of the student who has fear of examination as inner or saying that we must observe the patient that fear of examination with memory failure, with lack of confidence and mental exhaustion. So, anacardium knows the syllabus, but the mind collapses in the exam hall. Now, the most famous and practical feature of it is anacardium must remember in all cases, or I may say that it is a confirmatory symptoms of the anacardium is eating temporarily relieves all complaints. So, anacardium has eating ameliorates his all complaints. Headache better by eating, gastric pain better by eating, mental clarity improves after eating, anxiety reduces after eating. But remember, this relief is temporary. So after within 2 or 3 hours, symptoms return. When food acts like a temporary medicine, think of anacardium. So a weak next part is a weak exhausted nervous system trapped inside a divided conflicted mind temporarily rescued by food. So where you will see this patient uh, overstudied student who is studying over, nervous hysterical women, ill-natured children, old people, senile dementia type picture, neurotic or suspicious personality. So mental and emotional totality that we think of anacardium that we will discuss. So this is the heart of the remedy. If you miss this part, you will either over prescribe or never prescribe this remedy. So Phatak gives us a strong, strange but very real mental symptoms, and remember one thing clearly, that anacardium is not madness; it is an inner conflict. Anacardium is not madness; it is inner conflict with nervous weakness. So has a fixed idea and duality. Anacardium has fixed idea and duality in as we remember it as a two-will remedy. Pathak starts with a classical line in the mind: fixed idea thinks he is possessed of two person or two wills. So patient may say in OPD, one part of my me wants to do thing, right thing. Another part pushes me to do wrong thing, or I argue with myself in all time. So patient may say that my one part of my mind is want to do this thing, and another part want to do this thing. So this is not imagination. This is a real subjective experience for the patient. Anacardium battlefield is inside the mind. Their battlefield is inside the mind. Illusion of identity is very important characteristic of anacardium. So Phatak gives a very peculiar illusion that husband is not her own husband, child is not her own child, others are present behind her, sees faces in the mirror except his own. Now this is not a mean schizophrenia by default, or this is not mean insanity immediately. This appears during exhaustion, depression or senile changes. In the OPD, patient may say that I feel disconnected, nothing feels real, everything feels strange for the me. There is no reality in anything, all appears like a dream. This is called as depersonalization and derealization in the modern term. Depersonalization and derealization. Fear, suspiciousness, apprehension is also a key to the anacardium. So apprehends troubles from everything. Suspiciousness, very easily offended. Everything takes everything in bad part. Takes everything in bad part. Refuses to eat for fear of being poisoned. Nothing. Note that the contradiction, generally better by eating, but mentally may refuse the food due to the suspiciousness. Anacardium doubts other, doubts reality and doubts himself. Ill-natured, cruel personality. Dr. Phatak does not sugarcoat the anacardium. He clearly writes ill-natured, hard-hearted, cruel, profane, desire to swear and curse. So patient may say in day-to-day OPD that doctor, he was never like this before. He speaks very harshly now. He becomes rude and unsocial now. This cruelty is not a violent madness. It is irritability from inner conflict and weakness. Despair, cowardice, lack of confidence. Lack of self-confidence, cowardice, vacillating, hesitate, often does not nothing, despair of getting well. Very important that anacardium knows what to do but cannot act. Contradictory impulses, this is a golden symptoms of anacardium. Dr. Phatak writes that contradictory impulses, language at serious, laughs at serious things, remains serious when something laughable happens. When emotional response does not match to the situation, think of anacardium. Hallucination and abnormal perception. Dr. Phatak mentions that clairvoyant hears voices, affair or dead people. Senseless talks, screams loudly as if to call someone. So the important point is during nervous exhaustion these symptoms may appear, during hysteria, in senile dementia or in extreme mental weakness, not in stable or functioning individuals. Suicidal tendency, with note this suicidal tendency very carefully. Suicidal tendency by shooting, this is a specific impulse, not general sadness. This reflects inner conflict, despair, loss of control. As a clinician, we note it, not dramatize it. Senile dementia picture, Dr. Phatak describes it as a senile dementia remedy with suspiciousness, with memory loss, ill-natured person, refuses to eat, fear of being poisoned, but better by eating. Mental totality is inner conflict with duality, lack of confidence, bad memory from nervous exhaustion, suspicious, fear, apprehension, ill nature, rude behavior, hesitate and indecision. So anacardium mind is tired, divided and defended, not mad. In physical general, Phatak says that mind, nerve, muscle and joints are affected. So today we focus on physical general, the bridge between mind and body. General state is of lack of power. So physical and mental lack of power. Patient may say you that I feel drained, my energy is gone, even small work tires me. Weakness is nervous, not muscular, only trembling on slight exertion, especially knees and arms. Anacardium weakness is from nerves, not from blood loss or infection. Posture and activity, Dr. Phatak describes it as wants to lie or sit continuously. Motion aggravates, stepping hard aggravates. So patient prefers sitting quietly, avoids movement, complaints of heaviness and fatigue. So heaviness and fullness of whole body after piano playing. Dr. Phatak given this symptom, meaning that fine motor activity, nervous overuse or mental or muscular strain. Thermally easily chilled, better by heat and sunshine, worse from aggravation from cold, drafts, open air, better from heat, bath and sun. So anacardium is chilly, nerve sensitive patient. Eating temporarily relieves all symptoms. So before eating, feeling of empty feeling in the stomach, mental irritability, headache, weakness, anxiety. During and immediately after eating, feels better, mind becomes clearer, pain reduces, strength improves. After 2 to 3 hours of eating, gastric pain increases, weakness returns, irritability returns. So food act as like a temporary medicine for the anacardium. Weak digestion, loss of appetite alternating with violent hunger, hastily eats and drinks, breath stops while eating and drinking. Nervous control or digestion is weak. Thirst not very marked. Don't expect strong thirst symptoms of anacardium. In sleep, spells of sleeplessness for several nights, anxious, anxious dreams, energy is low, fluctuating, better after eating, aggravation from mental exertion, aggravation from mental work, emotion, anger, fight, care, and mortification. So, aggravation in the morning, evening till midnight, better after eating, lying on side and heat. So, main is better after eating and lying on the side. Nervous and muscular and joint symptom, paralysis of the muscles under voluntary control, trembling, paralytic condition, joint contracted, wounded tendons. So, nervous supply is weak, coordination is poor, control is reduced. So, intimacy of the symptoms comes and go, improves temporary, returns again. So, after eating and after sleep, symptoms come and go. Physical general, nervous exhaustion, trembling on slight exertion, aggravation from mental work, chilly patient but better by heat, marked relief from eating, wants to sit or lie down. Most important key sensation is sensation of plug, dull pressure or band or hook sensation. This is not poetic tongue, this is a patient's language. Plug sensation, patient may say that doctor it feels like something is stuck or as if a cork is pressed inside or a dull pressure or not a sharp pain. This sensation appears in the head, forehead, occiput, abdomen, rectum, extremities. So, anacardium pain presses, it does not stabs. Head and gastric and nervous headache, pressing pain from plug, dull pressure, temporal headache, occipital or forehead or vertex, amelioration by eating and failing asleep, aggravation by coughing, deep breathing, strong smells and mental exertion. So, headache is relieved by eating, should immediately rise the anacardium. Think of anacardium. Eye symptoms, pressing pain as if a plug on upper orbit, threads and black spot, object seems too far off, vision indistinct, short sightedness, nervous eye strain, poor accommodation, ear symptoms, hardness of hearing, pressing pains, imaginary whispers. This ties back to the nervous sensitivity, not a ear pathology. In no symptoms, smell loss, perverted or acute. Illusory smells, violent coryza with palpitation in aged patient. Face pale, wan, blue rings around the eyes, expressionless or wild or childish, eczema on the face and neck. Face reflects nervous exhaustion, not a healthy glow. In mouth, tongue feels swollen or stiff, impaired speech, much saliva, taste loss, bad breath. So, patient may say that, doctor, my tongue does not move freely. This reflects that motor weakness. Stomach symptom is empty feeling in the stomach, weak digestion, gastric pain better by eating, harshly eat, pain returns after 2 to 3 stomach feels empty even after food, but pain temporarily stop. In abdominal symptoms, plug sensation in intestine, flatulent colic, rumbling and pinching. In rectum symptoms, feels plugged and powerless, ineffectual desire, cannot evacuate even soft stool. The rectal paralysis, not the constipation from dryness. Urinary symptoms, frequent watery urine, clay color, sediment, burning in the glands during and after urination. Male symptoms, voluptuous itching of scrotum, seminal eruption without dreams, prostatic discharge during stool, enjoyment of absent, sexual function without satisfaction. In female symptoms, leukorrhea with itching, excoriating, frequent scanty menses, spasmodic abdominal pain, nausea of pregnancy, better by eating. In respiratory symptom, breath stops while coughing and swallowing, cough from talking and eating, vomiting of food with cough. In children, cough after anger, hysterical asthma ends in the tear. So, emotion directly triggers the respiratory symptoms in the anacardium. In heart symptom, double stitch in the heart, palpitation with coryza in aged people, extremities, knee feels paralyzed, bandaged, writer's cramp, neuralgia of the thumb, cramps in the calves, warts on the palms and hands. Sleeplessness for several nights, anxious dream, in skin, insensible keen, aggravation, itching, aggravation by scratching, neurotic eczema, wart and urticaria. So plug sensation, headache better by eating, rectum powerless, knee feels paralyzed, symptoms from emotion, nervous weakness everywhere. So the nervous system is correlation. Pathak repeatedly emphasized on neurasthenic patient, nervous exhaustion, disease of spinal cord, paralysis of voluntary muscle. So we may see in the modern diagnostic condition like functional neurological disorder, psychosomatic weakness, early neurodegenerative states, stress-induced neuropathies, writer's cramp, exam-related collapse in the students. Cognitive and memory complaints, bad memory, forgets names, forgets the surrounding. So, stress-related memory impairment, pseudo dementia, early cognitive decline, anxiety-related concentration deficit. In psychiatric behavioral correlation, anxiety disorder, obsessive indecision, paranoid tendency, depressive states in the irritability, personality changes in elderly. So, inner conflict plus moral struggle plus weakness of will. No violent psychosis but divided consciousness. So we may differentiate many much remedies with this. So ignatia, lycopodium, platina, rustox on mental plane, physical plane, and so we differentiate between anacardium and ignatia. So in mental sphere, main difference is anacardium is inner conflict, two wills, lack of confidence, hesitation, moral struggle. Ignatia has acute grief, suppressed emotion, contradictory symptom but emotional, not moral, sensitive, refined. In physical level, anacardium is better by eating, nervous weakness, plug sensation, while ignatia is better by deep singing, lump in the throat, spasmodic symptoms. So conflict and weakness, think of anacardium. Grief and sensitivity, think of ignatia. Another drug is lycopodium. Lycopodium has low confidence but hides it, wants power and control, fear of failure, not incapacity, bossy at home, timid at outside. In anacardium has no confidence at all, knows but cannot act, feels divided, fear of examining. In physical level, anacardium is better by eating, gastric pain relieved by food, lycopodium has aggravation from 4 to 8 pm, fullness after eating, gas, bloating. So, I can't do, think of anacardium. I must dominate, think of lycopodium. Another remedy is platina. Anacardium is inferiority, crowdy, vacillating, self-doubt. Platina has superiority, arrogance, looks down on others, proud. In physical level, anacardium has nervous weakness, paralytic feeling, platina has sexual excitement, numbness, spasms with pride. So low self-worth, anacardium, high self-importance, platina. Another remedy is Rustox. Rustox has restlessness, anxiety to meter by motion. Anacardium has mental exhaustion, indecision, conflict, aggravation from thinking. Physical level, Rustox has better by motion, aggravation from rest, stiffness on first motion. Anacardium has aggravation from motion, wants to lie or sit. So motion exhausts anacardium, motion release Rustox. So, when mental conflict, nervous weakness and characteristic modally present, think of anacardium. So, core or some prescribing totality for anacardium is in mind level, inner conflict, two wheels, lack of confidence, hesitation, indecision, bad memory from nervous exhaustion, suspicious, fear, easily offended, moral struggles, knows right but cannot act. In general level, nervous exhaustion, trembling for slightest exertion, wants to sit or lie down, aggravation from mental exertion, aggravation from motion. Marked relief of all symptoms for eating in temporary relief. Characteristic particular plug, dull pressure or band like sensation, rectum feels paralyzed, knees feels paralyzed or bandaged. This is the characteristic totality of the anacardium. The mind is divided, power is lost and food gives temporary relief. Think of anacardium. As we discuss remedy relationship, ignatia, emotional shock and grief, lycopodium, hidden imperative with dominance, platina, pride and superiority, rustox, restlessness with better from motion. Ignatia, when grief is dominate, think of ignatia. When ambition is dominate, think of lycopodium. In platina, when ego dominates, think of platina. When restlessness dominates, think of rustox. And in anacardium sits in the center where conflict is dominated. Potency 30, 200 and 1 M potencies are primarily used by me. In clear cut mentally picture anacardium 1 M infrequent repetition. This is all about anacardium. Anacardium in few words, how to describe conflict, weakness and relief by food is the anacardium. When patient fights with himself, loses confidence, feels powerless, eats to feel normal again, you are not treating laziness or attitude, you may think of treating anacardium patient. So, thank you very much for patience listening. Thank you. We will see in the next session. Thank you very much.